Hi, everyone. I'm really excited today to continue our partnership with Carbon Health, where we bring specialists in various fields and have them answer questions that you have directly from the community. And today I'm really excited to be joined again by Dr. Aaron Weinberg, who is a pulmonary and critical care and internal medicine doctor and the National Director of Research at Carbon Health, who has many years of research in the specific area that we're going to be talking about today. And in general, we'll give some information on blood clots, but we'll really be talking about two main specific types. The first being something known as DVT, or deep vein thrombosis, and the other being PE, or pulmonary embolisms. So you might hear some of those abbreviations throughout our conversation today. And I'm going to turn it over to Aaron to give some statistics on these two conditions.
Well, thank you so much, Dr. Swanda, for having me today. I think you do such a tremendous service to the general population. I think it's important for people to understand their health and educate themselves, because knowledge is power with your medical history and your general health. So thank you for having me on today. So DVT and PE, it's a very common condition, actually, and most people are not aware of that. And I think I usually joke around and say that DVT and PE hired a bad PR firm. And the reason being is that there's a lack of general awareness about how common this condition really is. You know, we all know about heart attacks. We all know about strokes. We can probably recite the signs and symptoms of each of those conditions. But when you ask someone, what is a DVT or PE, most people look puzzled and kind of vaguely know what you're talking about. But DVT and PE are the third leading cause of cardiovascular death, actually, in this country behind heart attacks and strokes. It's very common. Over 1 million people in the US are diagnosed with it per year. And unfortunately, it's very deadly. Over 100,000 patients in the US die of pulmonary embolism every year. And unfortunately, sometimes you don't even know you have the condition until you're already dead. There's been multiple autopsy studies out there with hundreds of patients that show the correct pre-mortem before death diagnosis was only made in less than 10% of the cases. So there needs to be more understanding, both in the general population as well as with healthcare professionals out there. And I think one reason I'm so passionate about this condition is that it really affects the whole population. Whether you're young, old, healthy, or sick, everyone is at risk for this.
And I think that really leads into one of my main questions of why do we even need blood clots if that they're having this negative adverse effect on our health in some of these conditions?
Yeah, it's a great question. And usually blood clots are protective. They're actually advantageous. As we're going about our daily lives, we bump into things, we play sports, we run into the edge of a table. And blood clots act as a control mechanism. So when we have a trauma, they end up going to the area of injury. They plug up the little blood vessels there and prevent catastrophic bleeding. So there always needs to be this balance of the protective nature of blood clots, the ability to form them, but also the ability to not form too many of them. And if you blood clot too easily or too much, then that can cause a whole host of clinical problems. And I think your body is in this state, we call it homeostasis, where there's this fine balance between doing something too much and doing it too little. And you really want to be in that balanced state, but there are factors that can tip you in one direction or the other. And that's when you develop certain pathologies.
So when these blood clots are necessary to form, how do they actually form in our bodies?
So specifically speaking to deep vein thrombosis or DVTs, those are blood clots that typically form in the legs, the big vessels of your legs, the veins of your legs. And over 95% of the time, pulmonary embolisms, which are what we call the blood clots when they go to the lungs, they start in the legs over 95% of the time. And then they break off and they travel up through your veins, up through the right side of your heart. And if you remember from physiology class back in the day, the right side of the heart pumps blood to your lungs to pick up oxygen. So it takes deoxygenated blood with less oxygen, pumps it back to the lungs to pick up oxygen, and then back to the left side of the heart to the rest of your body to oxygenate your organs and your tissues. Now, when these blood clots form in the legs, they break off, they travel through the right side of the heart, and then they're pumped into the lungs where they start plugging up the blood vessels of the lungs. And it's a little bit analogous to putting your finger over a fire hose, because when the right side of the heart has to pump against all of these plugged up blood vessels, it creates a lot of back pressure on the heart, and the heart ends up failing. And that's why people die of pulmonary embolism. They actually die from right-sided heart failure. Now, you can develop blood clots or deep vein thromboses of the upper extremities. That's possible, of your arms. However, that's much more rare.
So it seems like these are such serious conditions. And as you mentioned with the statistics, they can affect a lot of people. So what are some of the common risk factors for DVT and PE that we can be on the lookout for?
Yeah, well, there's two kind of main buckets that I like to group patients in. There's those that have a genetic predisposition. So kind of the things that you really can't modify, you're just born with it. Those are those people that have genes that make them more susceptible to forming blood clots and put them at higher risk of this condition. So there's a segment of the population due to genetics that forms blood clots more easily. However, there's also a large percentage of the population that develops blood clots due to just environmental factors, as they're going about their daily lives. There's things that happen that put them at higher risk of forming blood clots, regardless of what their genetic predisposition is.
And what are some of those environmental factors that could predispose someone to these conditions?
So one of the main common ones is immobility. So if you're not moving around very much, if you're bedbound, if you're laying around in bed, that puts you at much higher risk of forming blood clots in your legs. And the reason for that is anytime you're not moving your legs, blood tends to pool in those blood vessels. And when blood isn't circulating, clots tend to form. One of the common causes of blood clots is someone who had recent surgery, or maybe they were hospitalized for a medical condition, or maybe they were just very sick at home with the flu and they were laying in bed for 3 days. Anytime you're not moving around a lot, that puts you at high risk. And in fact, over 50% of these blood clots end up happening either during hospitalization or shortly after hospitalization for that very reason. So periods of immobilization can increase your risk. You may have heard long travel. If you've had extended travel where you're on an airplane for 14 hours and you're not moving about the cabin and walking around, that can put you at higher risk for the same reason. There's certain infections that can put you at higher risk because they're pro-inflammatory. They cause inflammation in the body, and that then leads to blood clotting as kind of a response to that inflammation. One of the common infections that we've all heard of is COVID-19. We've seen a higher association with DVTs and PEs in those patients that have COVID-19. Interestingly, pregnancy, pregnancy's a common thing, and it puts you at 5 times higher likelihood of forming a blood clot while you're pregnant. And that risk actually can last up to even 3 months after delivery. So we always ask our pregnant patients, are they having any signs or symptoms of this condition? Some other common ones, cancer. Cancer is a prothrombotic condition. It makes you at higher risk of forming blood clots. Certain medications, such as estrogen therapies, whether it's hormone replacement therapy or even oral contraceptives that are estrogen-based, can put you at higher risk. And then another big one that impacts, unfortunately, a large percentage of our population are those that are overweight or obese. And the reason for that's kind of interesting. It's not just because people who are less well-conditioned don't move around as much, which is one of the earlier reasons I gave, immobility. But interestingly enough, when we're overweight or when we're obese, we have more adipose cells, more fat cells. And adipose tissue produces estrogen. higher levels of estrogen in our body. And like I mentioned with the oral contraceptives a minute ago, higher levels of circulating estrogen actually put you at higher risk of blood clotting. So that's one of the reasons why people who are overweight are also at increased risk.
And if we jump back to when you talked about the immobilized individuals being higher risk, does that also mean that if you're quite active, that you don't always have to worry about DVT and PE as much?
Not at all. And I mentioned, there are certain genetic risk factors, there's certain situational risk factors. If you, let's say, were a very active person and maybe you had knee surgery and then you were temporarily immobile. But I think we can look to common popular culture as some examples. And these are in the news. I'm not breaking any HIPAA violations by mentioning them. But Serena Williams, very famous tennis player, had blood clots. Chris Bosh, basketball player with the Miami Heat, who won an NBA championship, unfortunately had to retire because of blood clots. There was recently in the news this week, Al Roker of the Today Show was hospitalized with blood clots. I'm a big music fan, and there are reports out there that Jordan Feldstein, who was the manager of Maroon 5 and a good friend of the band Maroon 5, died of pulmonary embolism. And that the song Memories is actually written after his memories. But it's not just well-known individuals. It really affects moms, dads, brothers, sisters, everyone in the population.
For sure. What are some things that everyone can be on the lookout for related to signs and symptoms of DVT and PE so they can hopefully try to get treatment before they end up having some serious consequences?
Yeah, I think awareness is key. You hit the nail on the head. And it's important to know both the signs and symptoms of deep vein thrombosis, DVT, as well as pulmonary embolism or PE. Sometimes people can pick up the DVT early on and they may realize that they have some leg swelling. They may have some redness in their leg or some pain in their leg. That may be an early sign. However, sometimes they never realize that they had a DVT and their first manifestation of symptoms is actually a pulmonary embolism. Some of the symptoms of pulmonary embolism to be aware of are chest pains. And sometimes that chest pain is worse when you take a deep breath or when you're coughing. Patients will a lot of times have shortness of breath, activities that usually they didn't think much of. All of a sudden, they feel more winded when they do them. They may experience a fast or irregular heart rate or palpitations, we sometimes call it, irregular sensations in the chest. Sometimes people can even present with back pain because remember, your lungs are both at the front of your chest as well as in the back. So sometimes people will feel a little pain towards the back of their chest area. Although it's more rare, occasionally patients will cough up blood. And then another telltale sign is vital sign changes. So you may notice that you have all of a sudden low blood pressure, or you may feel dizzy, or you may even pass out. Those could be signs that you may have a pulmonary embolism, and it's worth getting checked out at that point.
And an individual comes in, let's say they have some of these symptoms. What is their timeline in terms of going to seek help?
Well, I think as soon as you recognize that you may be having symptoms of a PE or a DVT, like I just described, and you may have noticeable risk factors. Some patients don't have any of those risk factors I mentioned earlier, but you may recognize that you have some of those risk factors, and you may want to be at a higher sense of alert if you recently had surgery or you're on an oral contraceptive, let's say, and you're experiencing such symptoms. Time is of the essence. Time is key. And really, it's important to get help as soon as you recognize that something may be wrong. And usually you'll go to your local emergency room or urgent care, and you'll get further imaging to diagnose whether you're having a DVT and or a pulmonary embolism.
And then what does the treatments actually look like for somebody who comes in, they are confirmed to be having DVT? Is there anything available for that individual?
Absolutely. The treatments are very effective once we recognize what's going on. And the mainstay treatment are anticoagulants or blood thinners. And you may have heard of some of them on the market. There's Coumadin or warfarin is one of them. There's also some of these newer drugs, such as Xarelto or Eliquis, which you may have seen on the market. And they work a little bit differently, but essentially at the end of the day, they thin your blood and they stabilize the clot. So what they do is they thin your blood so you don't form more clots, and then they stabilize the clot that you currently have and allow your body the time it needs to break it down. So it's interesting, they don't actually break down the clots, but they stabilize the clot, and it's your body's own mechanisms that help break down that clot over time. And then in the meantime, the blood thinners prevent the clot in the legs from breaking off and forming more potentially deadly pulmonary embolisms.
Yeah, definitely a big misconception for blood thinners, I think, out there in terms of actually clearing the clot versus preventing more clots from being formed. How about any type of surgical interventions that take place for people with DVTs or PEs?
So there are, depending on the individual and how they're presenting clinically, those that have more severe deep vein thromboses, or they're at higher risk of worse outcomes from pulmonary embolism if they present, let's say, with low blood pressure or very symptomatic, there are certain things that can be done in addition to those blood thinners and to more urgently intervene. Some of those include a medication called TPA, which is a clot busting medication. So that medication actually goes in and tries to break up the clots quickly. There is an increased risk of bleeding with that medication. So we don't use that with every patient, but for the right patients, we may choose to use that if it's a more severe situation. There's also devices where you can actually go in and break up the clot or extract the clot. So it's really tailored to the particular case and situation, but there are additional techniques we could use.
So now that we've talked about some of the environmental factors and you brought up the genetic factors earlier on, what are some ongoing risks for an individual if they did have a DVT or PE? How long are they actually treated for that condition for, and how long should they be on the lookout for something coming back?
Generally speaking, we keep someone on a blood thinner for at least 3 to 6 months for their initial event. Now, whether we stop the blood thinner after those first 3 to 6 months or continue it indefinitely depends on someone's ongoing risk factors. So if someone has a strong genetic predisposition, maybe we tested their genes and it came back positive, or maybe they have a strong family history of blood clotting, we may choose to keep someone on a blood thinner longer, maybe even for the rest of their lives. Now, if it was someone who had a transient risk factor, meaning they just had, let's say, knee surgery, now they're active, now they're recovered, we would treat them for those initial 3 to 6 months, and then we may choose to stop the blood thinner after that. Now, with that said, anyone who has had a DVT or PE is at a higher risk, even if it was a transient risk factor that led to it. So anyone who's had one episode is at a 5 to 7% per year increased risk, which is about 50 times higher than the general population who never had a blood clot. So we may weigh the risks and benefits and decide to stop the blood thinner, but we're always at a high index of suspicion, and we're always monitoring these patients closely in case they develop any future symptoms that could be suggestive of a recurrence. And sometimes I tell my patients, if I choose to stop your blood thinner, I may put you back on it temporarily during those periods of time where you may be at higher risk. So if you're going on a long plane ride, maybe I put you on a blood thinner for a few days during that period of time in order to protect you.
Okay. Yeah. So really looking at an individual's circumstances at that time.
Yeah. And I think that's really important if you have had a DVT or a PE to talk to a healthcare provider or a clinician that you trust, that understands this condition, and that you can really kind of weigh the pros and cons of all these decisions, and that they continue to follow you long term. So as new issues arise, they can guide you and deal with that.
So as we close out this great conversation, just what's something they can take away from DVT or PE?
Yeah, I think the main point that I'd love to raise with your viewers is that awareness is key, and awareness is life-saving. DVT and PE are part of a spectrum of the same condition. Whether you catch it while it's still in the leg or whether it breaks off and it goes to the lungs, it's part of the same kind of spectrum of disease. And it's common. It's very common. It's very deadly. And unfortunately, we've done a poor job in the medical community of raising awareness for this. So I think because it impacts everyone potentially out there, It's really important that people know the signs and symptoms of it, know the risk factors, and if they are experiencing anything that could be concerning for a DVT or PE, that they go to their medical professional and get it evaluated, because time is of the essence. It could be life-saving.
Yeah, I think that this was such a great conversation and definitely will bring awareness to these conditions. So that is every viewer's job, is to go educate somebody on DVT or PE, so that way we can continue making individuals aware of this condition so it can be caught earlier, treated earlier, and we can avoid some of these really serious complications that Dr. Weinberg talked about. So with that, I just want to thank Dr. Weinberg for today, for his time again, for coming on, and I look forward to talking with you again in the future on another topic that's requested by the community.
Great. Thank you for having me.
Yeah, and I'll be sure to post a link below for you to go to the Carbon Health website so you can learn more about the different offerings that they have. So with that, we look forward to talking to everybody again soon. Thank you. Bye.